Typhoid fever, also called as enteric fever, caused by bacteria Salmonella typhi. Mode of transmission include ingestion of contaminated food or drink, finger-to-mouth contact with feces or urine. Symptoms: fever, stepladder pattern, and followed by abdominal pain, vomiting, headache, diarrhea, anorexia, and T-sub diarrhea is due to decreased absorption of bile from the intestine. Signs include relative bradycardia, dichrotic pulse, and coated tongue, rose spots, hepatosplenomegaly in the second week. Rashes are rose spots 2 to 4 mm in diameter with raised discrete irregular branching pink macules found in front of the chest and appear in a crops of up to a dozen at a time and fade after 3 to 4 days. Complications, intestinal bleeding or perforation. CBC will show leukopenia or eosinopenia. Other bacterial causes of infection will cause leukocytosis and SGOT, SGPT will be high. Blood culture will be positive from day one. If patient took antibiotic, it will be negative. Stool culture is positive in the third week and it is important in the carrier stage. Viral test has low specificity and sensitivity. O antigen more than 80 is positive and H antigen more than 160 is positive. Two serum samples of viral test with 7 to 10 days gaps are better to see the rise in the antibodies. But after first week, it is falsely positive in malaria and brucella. Typhoid after 3 days of infection, this antibody test can be useful. From day one itself, what is useful? Blood culture is 80 to 90% specificity is there. Non-specific standard laboratory tests are anemia, moderate anemic, ES are elevated, and platelets, thrombocytopenia, and lymphocytes relative lymphopenia, and slightly elevated growth PT and APTT, and liver enzymes, elevated liver transaminase and bilirubin, and serum electrolytes, mild hyponatremia and hypokalemia. What is confirmed case of typhoid? Fever more than 38 with at least 3 days with a positive culture. What is probable case? Fever more than 38 centigrade at least for 3 days with serological positive without culture positive. In case of remote places and limited resources places, high-grade fever with low stools and coated tongue and relative bradycardia includes 94% specificity. Treatment of uncomplicated typhoid. So usually we start with ofloxacin 400 mg PD. So we always over-treat rather than under-treat. We see the response at the day 5. If the response is there, continue for 5 more days. If there is no response in day 5, add cefixime 400 mg PD on the day 5. If the response is there, we will continue the cefixime. If there is no response, stop the ofloxacin and continue cefixime along with azithromycin for 5 days. Treatment of complicated fever. Complications include CNS seizures, altered sensorium, respiratory cramps, and serious murmur and arrhythmia. IV antibiotic include ceftriaxone 60 mg per kg per day for 2 weeks or 2 gram twice daily. Better to give overdose than underdose. Cefotaxime 80 mg per kg per day for 2 weeks and roll of steroids in case of severe shock or obtundation. Dexamethasone 3 mg per kg body weight stat followed by 1 mg per kg every 6 hours for 8 doses. So MDR resistant is resistant to chloramphenicol, amoxicillin and Septran. But HDR is resistant to even fluoroquinolones and cephalosporins. In these cases, meropenem 1 gram TDS for 10 to 40 days is given. Carrier state is asymptomatic stool or rectal culture, it will be positive. And a convalescent carrier, shedding of bacilli for 3 weeks to 3 months. And temporary carrier 3 months to 1 year. And chronic carrier more than 1 year. Treatment of carrier state includes ciprofloxacin 750 mg for 28 days. If there is cholelithiasis, we have to do cholecystectomy. Thank you.
The formula for failure: a few errors in judgment repeated every day for 1 month starts the weakness, starts the disaster process. You can imagine what happens in 6 years. Now here's the formula for success. A few simple disciplines practiced every day. And if you decide today to go for the apple instead of the Hershey bar, I'm telling you, you have begun the process of turning your life around. And if you keep up that process, not only with your health habits, but with your money habits and with your communication habits, with your sales habits and management habits and every other habit that you've got, if you'll start that process, eliminate the errors and replace it with disciplines practiced, I'm telling you, you can start this process of life change immediately. After today, you don't ever have to be the same again. Only by choice.